Welcome to the digital platform of Tarun IAS. As you all know, that we are witnessing major rise in the cases of dengue in different parts of the country. In Firozabad, 60 children have died as a result of dengue fever, while 465 children remain in the district's medical college's child ward. After dengue cases crop up in Ludhiana, civil surgeon had issued an advisory, an appeal to the people. In Mumbai too, number of cases have increased in the last few days. Hello everyone, my name is Shreya Tandon and today I'm here to tell you more about this viral disease called dengue. What is dengue? Dengue fever is a mosquito-borne disease. It is known to be caused by one of the 4 closely related dengue viruses. These viruses are associated with the viruses that cause other types of illness, such as West Nile infections and yellow fever. What is West Nile infection? West Nile infection is the leading cause of mosquito-borne disease in the continental United States. It is most commonly spread to people by the bite of an infected mosquito. What is yellow fever? The yellow fever virus is found in tropical and subtropical areas of Africa and South America. The virus is spread to people by the bite of an infected mosquito. This type of fever is transmitted by the bite of an Aedes mosquito infected with the dengue virus. Now let's talk about the first evidence of dengue in India. The first evidence of dengue was seen in the country in 1956 from Vellore district in Tamil Nadu, where they saw a major outbreak in Calcutta with more than 30% cases. What are the symptoms of dengue? Dengue symptoms usually begin 4 to 6 days after the infection, and it can last up to 10 days. Some of the major symptoms include severe headaches, excessive pain behind the eyes, joint and muscle pain, feeling of fatigue, nausea, vomiting, and skin rash. Usually, these symptoms may be mild, and it can be mistaken for those of the flu or another viral infection. People who have never had this infection before tend to have milder cases. However, serious problems can develop. Some of these problems include dengue hemorrhagic fever, which is a rare complication characterized by high fever and bleeding from the nose and gums, enlargement of the liver, and failure of the circulatory system, etc. The symptoms of dengue may progress to massive bleeding and death. This is often called as the dengue shock syndrome, and people with weakened immune system and those with subsequent dengue infection are believed to be at greater risk for developing dengue hemorrhagic fever. Now let's understand that how can this dengue fever be spread. The mosquito acquires the virus by biting an infected person and transmit to another person. This type of fever does not spread directly from person to person. This transfer of dengue causing virus from one person infected with dengue fever to a healthy one through is a major case of dengue. When a mosquito bites an uninfected person, the virus enters the mosquito through the bloodstream. Therefore, it is released into the host when the same mosquito bites another person. Now, when we talk about the vaccinations, there are certain preventive measures and vaccines available for dengue. If a person is suffering from dengue, generally becomes immune to that strain of stereotype. Dengue is known to commonly spread in human inhabited areas, and these disease-causing vectors rapidly breed in stagnant water. For example, open drains, water-filled disposed tires, open tanks, and other stagnant water sources. What are the dengue fever treatment? If your doctor diagnosed that you have a mild case of dengue fever, it is recommended for you to take complete rest. It is advised to take pain relievers such as acetaminophen and drink a lot of fluids. In case if you have more serious symptoms such as vomiting or strong pain in the abdomen, one should seek medical care. How can we diagnose dengue? Dengue infection can be diagnosed with a dengue blood test. This will help you check for the dengue platelet count. The first test is the dengue NSI antigen. This is a blood test to detect the dengue virus early in the course of an infection. When to get the test done? It should be done within the first 5 days of the appearance of symptoms, because the first 5-7 days, the chances of false positive and negative results are high. The second is the immunoglobulin M. This test looks for IgM, that is the antibodies in the blood, which appears in the early course of the disease. The test can also help to differentiate between primary and the secondary infection. When can you expect the results of this test? Depending upon the method used to detect the antibodies, you can get the test results within 30 minutes or around 1 or 2 days, and it may vary for each lab. Third is the immunoglobulin G. This test is used to detect infection in the later course of the disease because the level of the IgG in the blood tends to increase slowly. Usually, the level increases 6 to 10 days after the infection, and the antibodies can remain in the blood for around 90 days or for the rest of your life. To distinguish between the primary and the secondary dengue infections, IgG or IgM ratio test is commonly used. Fourth and the last one is the dengue RNA PCR test. It is a primary test which is used to detect the dengue virus in the early course of the infection. A positive result not only confirms the infection but also helps to identify the different serotypes of the dengue virus. The test is around 90% sensitive and 95% specific. How to prevent dengue? We can prevent dengue by following a few crucial steps, such as if you travel to an area that has dengue fever, you can avoid mosquito bites by doing the following. First, we must use mosquito repellents that contain 20 to 30% DEET. Second, we must wear long clothing outdoors, especially at night, since during the night the mosquitoes are likely to be more active. And third, we must remove standing water and fill low spots where water can pool. Now, let's talk about some of the initiatives which are launched by the Government of India and other states. Mortality can be minimized by early diagnosis and prompt symptomatic management of the cases. Guidelines for clinical management of dengue fever mid-term plan has been approved by committees of secretaries for prevention and control of dengue, which has been shared with the states for implementation. The main component of mid-term plan, which is known as Octolog for prevention and control of dengue, are surveillance, disease and epidemiological surveillance, case management, laboratory diagnosis and clinical management, vector management, environmental management for source reduction, chemical control, personal protection and legislation, outbreak response, epidemic preparedness and media management, capacity building, training, strengthening human resource and operational research, behavioral change communication, social mobilization and information education and communication. And lastly, intersectoral coordination with ministries of urban development, rural development, Panchayati Raj, surface transport and education sector. Lastly, when we talk about other states, Delhi government in 2019 launched a campaign 10 hafte, 10 baje, 10 minute dengue campaign. The Delhi Chief Minister appealed to Delhi residents to give 10 minutes every Sunday from September 1 till November 15 to ensure that there is no stagnant water in their house and surroundings. So this was all about this topic, and if you've liked the video, don't forget to like, share and subscribe. Thank you.